Okay, this is skill 2.24, administering oral medications. So the first thing you're going to do is you're going to check your medication order, right? And you're going to have gone to the med dispensing unit and taken out from storage the correct medication, okay? You're going to check the MAR with the medication label to verify correct medication and expiration date. And you're going to sign out any controlled medicine following agency policy. So, what do? You check the medication label 3 times for safety. The first time that you checked it was when you were pulling it out of the med dispensing unit, right? Okay, and then when preparing it. So I'm preparing it now. I'm looking at my med, okay, and I'm saying, yep, it's the Prilosec that I want, and here is the cup that I'm putting in, okay? So I'm preparing it, right? All right. So I've brought it to the room, and then I'm going to check it again when I'm administering it with the client, all right? You're going to prepare the correct amount of medication without contaminating it. It's in a concealed container, right? So it's not contaminated, right? Right. You're going to bring with you fresh water to the bedside for administration of the medication. So you're going to make sure that you have your pitcher of water and your cup, okay? Pour the water in there. Now you're going to ask the patient, do you like to take your pills with water just in a cup, or would you like a straw with it? Some patients have issues with trying to swallow pills as well as suck through a straw to swallow the pills. So ask them, okay? Simple, right? All right. Then you're going to perform WIPSA. You're going to do all of that stuff, okay? Wash your hands, identify yourself and the patient. You're going to provide privacy. You're going to explain to the patient what you're doing. You're going to make sure that they're safe, okay? And you're also going to ask for allergies. And then you're going to explain all medications to the client. This is the last safety check and the purpose of the medications. So you're going to, hello, I'm Kathy. I'm going to be your nursing student today from Alfred State. Could you please tell me your name and your date of birth? And do you have any allergies that I should be concerned with? Oh, no, good. All right, so right now I have some Prilosec that the doctor has ordered for you. Prilosec helps with your stomach. It's to help with the acid reflux, okay? So it's time for your Prilosec. And so I have some water here and I have your pill. Would you like to take your pill with, do you need a straw in your water? Oh, no? Okay, great. So I have Prilosec, and it is 20 milligrams, okay? So you would open the pill, okay? We're not going to do that because, you know, you're not going to be first of all administering it to the mannequin, and second of all, there's no need to pop it out if we're not going to give it, right? Okay, but you would if you were giving it to a patient. You didn't close my door, did you?
No.
All right. You would pop it through, and at the hospital, okay? And then you would have the water and the pill. You would hand it to the patient, the pill to the patient. Or, wait a minute, have you ever tried to swallow a pill without taking a drink first? Yes, exactly. We want to make sure that our patients' oral mucosa, or their mouth, is wet enough in order for the pill to go down. So you're going to offer them a drink first. Here, would you like to take a drink of water first? Oh yes, we have to definitely wet your whistle. It's hard to swallow a pill when you're dry, isn't it? Yeah. Okay, so here's your pill. Okay, and then here's a little bit more water. Did it go down? Oh yes, it did. You having any complications? No. Okay, great. Are you having any pain? No. Okay, great. All right. So, and then you would discard the medicine cup, and you would document in the client's record, in the MAR, the pill that you just gave, right? And what are you going to use? You're going to use the date and the time, right? in the correct box of the MAR, right? And then you're always going to continually assess the clients. Now, if we were administering a medication to a child, we may actually have to use a dropper, okay, and administer it to a child, okay? So this dropper is used to administer to somebody that is young, not able to swallow. And what you do is you just take it and you put it inside their mouth, beside their cheek and teeth, and you just slowly infuse it, okay? You see how it's going down in here? See that? Okay? And you would just, don't go squirt all of it in there, because what are you going to do? You're going to make them choke. Okay? So we just want to drop it in, okay? Or allow them to suck it in, okay? They could actually just suck it in too, if they're able to do that, just like if they were sucking out of a straw. Okay, so that's how you administer PO to a child if it's a liquid. Okay, all right. So that is scale 2.24, administering oral medications.